Need to move along, so I need everyone to take a seat. Yeah, why not? Everybody, please, Dr. Alperin, Dr. Reinertz, Dr. Keir. Hi, Dr. Allensworth. Hello, everybody. Have a seat.
Yes, I'm very nervous.
Oh, don't be nervous. Okay. You ready to record? Oh, good. Welcome, everyone. I do have two or three pictures of Dr. Deiss that I took about 2 weeks ago. This is one from 2 years ago that you may recall was in one of our, I think, e-newses or in one of our newsletters. This was about 2 weeks ago. He's doing well. His memory is not good, but he is doing fine. He kept wanting to, he asked Liz if he could turn the lights on outside, and it was 4:30 in the afternoon. He liked turning the lights on, looking out in the yard, and he repeatedly asked her. When I arrived, he had a big smile on his face, and I gave him a hug, and he said, "You're looking great. How long has it been since you've been here?" And I said, "Well, it's been a couple months." And he said, "Well, you're looking great." And I later learned that he had mistaken me, I think, for a former yard man. But, you know, if Dr. Deiss says you're looking great, you take it. Today we're going to hear from a number of people who I have asked to say a few words, whatever you like, about what Dr. Deiss meant to you. And we're going to go ahead with the meal. It's buffet, is that it? Is it buffet? Okay. Why don't we go ahead and serve ourselves, and then we'll come back and start with some of the reminiscences, okay? Can we do that? Thanks. One welcome is Paula Roberts. Paula, would you stand up for us, please? Paula's Dr. Deiss's daughter who's here. He has other children, but please stand so everybody can see you. Paula. She lives here in Galveston, and we saw each other just the other night because our grandchildren are basically on the same team playing t-ball. I'd like to call Dr. Dan Allensworth up first and say a few words. Dan?
Oh my gosh. Well, I have two short stories to tell about Dr. Deiss. The first one was related to the course we used to have called IPE, Introduction to Patient Evaluation. It was for the freshman students. And us and the faculty had maybe 10 students in our groups. And the students kept saying that they were just spent all their time in lectures, and they wondered if there wasn't some way they could go into the hospital and see what medicine was about. And so they talked me into taking them up on the ward. And so I took them up there, and they were, of course, in their T-shirts and their shorts and their blue jeans. And unfortunately, Dr. Deiss was on the ward. And it's the only time I've ever seen him be angry. And he was really upset, not with the students, but with me. And so I tried to explain to him that I told the students that they should be better dressed than they were to go on the wards. But unfortunately, I took them anyway. And I forget all the things he said, but basically he told me that I was in real danger. And finally, he couldn't get over being angry, and he had a wad of paper or something in his hand, and he threw it down in the wastebasket and marched out of the nurse's station. So I've never seen him that way before, but I realized, and I can remember him saying how important it was for the house officers to be well dressed, and certainly not the students. The other thing that I remember is when Dr. Deiss first came to Galveston, one of the things he said to us, as I remember it, was that having good house officers was an absolute necessity of an internal medicine department, and that you had to have good house officers no matter what else you had. That was really important, and that he was going to devote himself to having good house officers. And he, as I remember it, he brought some people from Duke, members of the faculty, down to consult with our faculty about what house officers should be. And they came and we would meet and they would tell us about how wonderful Duke was. And then they asked about how the house officers were on call. And I forget what we said, but it was basically we had a rotation and they may be on every 10 nights or whatever it was when their name came up, and that there might be, I think, 1 or 2 house officers, not counting the interns, but counting the residents, who would be on call, and one of them would take care of consults and the other would work around the internal medicine wards. And the people from Duke were appalled. And they said, "You mean they're not on call more than every 10 nights?" And we tried to explain to them that really the call system wasn't the only thing, that the residents and interns who were attached to the wards took care of their patients even at night. And they felt their job was to keep the on-call house officers from having to go to their wards and take care of their patients. So it was kind of among the house officers, it was bad form if the on-call doctors had to go and look at the patients on the wards. But that didn't satisfy the people from Duke. And I don't know what Dr. Deiss did about it. I've forgotten. But as I remember it, I don't think he changed the call system very much.
Hi, everyone. I came to the UTMB the summer of 1963. Bill Levin had recruited me to come as a senior research fellow in hematology. At that time, Ray Gregory was the chairman of medicine. shortly before I came to UTMB, the Clinical Research Center opened. And so I was involved in a number of research projects involved in hematology in the Clinical Research Center. I was interested in folic acid and vitamin B12 deficiencies, and I was interested in abnormal hemoglobins and how they caused hemolytic disease. And I used the Clinical Research Center as a way to study these patients. The Research Center was funded by the National Institute of Health, and so 2 or 3 years after the center was open, the NIH sent a committee of academics to Galveston to look over the research center and decide how effective this was. Was the NIH getting good value for its money? And so those of us who had been involved in research in the study center then met with this committee and told them what we were doing. Bill Deiss was, if I remember correctly, Bill Deiss was one of the members of that committee. And I presented to Bill the work I was doing. It was very obvious he didn't like what I was doing. He didn't think it was good at all. And he made it very clear in no uncertain terms. And that was my first introduction to Bill Deiss. A few years later, I discovered what Bill Deiss is now the chairman of the Department of Medicine at the University of Texas Medical Branch. And I'll be perfectly honest with you, I was scared of the man. I really was scared. But it turns out that he was a very supportive person. He supported me in anything and everything I wanted to do. He encouraged me. He gave me plenty of opportunities to do things, and apparently I did them well because he gave me more things to do, and he always encouraged. He always said you were doing a good job, and he helped me develop as an academic. And I'll always be grateful for Bill Deiss for doing that. I started out scared of the man, but I got to the point where I loved the man. He was a big part of my life and my career development.
Well, as with the first two speakers, I was here during the transition from Dr. Gregory to Dr. Deiss. And actually, my training as a resident and intern and resident and as a student was under Dr. Gregory, and then I was chief resident with Dr. Deiss and faculty, junior faculty with Dr. Deiss. I was resident with Dr. Gregory. And both of these gentlemen were bigger than life. I think they were tremendous role models, but there was really a tremendous transition that took place in the department with the arrival of Dr. Deiss. When I was an intern resident, we really had very little supervision. We had a morning report, and we were allowed to present one patient and present one follow-up, and that was it. And it was literally possible as a resident to select a patient that you wanted to admit, because you could select the patients from the waiting list that you wanted. If you didn't want them, you didn't admit them. Admit a patient, treat them, and discharge them, and nobody except you and your students knew that they were even there. And if something bad happened, nobody even knew it happened. We had staff, physicians assigned, and their primary role was to teach students. And as the house staff, we generally didn't even attend the meeting with the attending staff that came to the ward. We could talk to them about a problem, but we generally didn't think that they knew enough to even answer our questions because we knew more than they did. We learned later that we really didn't as we got smarter. But when Dr. Deiss came on board, that really changed. And I think he personally knew everything that happened with every patient on the medicine service. I learned a great deal from him as a chief resident. I spent 2 years in pathology between internal medicine and the time I became chief resident. In fact, I was a junior faculty person as a chief resident and was working part-time in pathology as chief resident internal medicine. I had some very interesting experiences with him that I learned a great deal from. He was as has been emphasized, he was a really stickler for excellence. And the high point of the week was Grand Rounds. And I was in charge of Grand Rounds. And that was a tremendous amount of anxiety for me to try to find something to present that would meet his expectations at Grand Rounds. We had a young man in radiology that was doing coronary angiograms. And you have to realize that this was back in 1968, somewhere along there, 69. The first angioplasty that was ever done in the coronary artery was in 1978 by Dr. Grunswig, who came to Duke from Germany. And so this was all before that sort of thing. But this guy was doing coronary angiograms. Very interesting, and I asked him to give the Grand Rounds. And he did, and it was very interesting. Everybody was fascinated, asked questions and this sort of thing, and I was quite proud of myself as we was going back to our office until Dr. Deiss said, "Gerald, I'd like to see you in my office." That was always an ominous thing. He came in and he said, "I don't want to ever have another Grand Rounds like that." And I said, "Really? What was the problem?" He said, "Well," he said, "that was all quite interesting, but really, quite frankly, what can you do with that information anyway?" He was of course right, but 10 years later, something was done with the information. One of the things that I got really interested in as chief resident is I thought we needed a brochure for recruiting house staff. I'd seen other departments that had them. We didn't have one. I talked to him about it. He was kind of lukewarm, but I said, I will do it. And so I had access to a dark room. I took photographs of all the different sections and departments. I took conferences, et cetera. I developed film, printed them, did write-ups, did layouts, took it over to the printing shop, that was before computers, and had it all, and finally got a proof. And it was about 8 by 12 and had about 16, 18 pages. And I brought it in and showed it to him, and he said, "My gosh, this is great. It's much better than I ever expected. Why don't you see if they can do it in a cheaper version?" So that was how that went. He taught me something that I think has stayed with me for the rest of my career. I used to, still do at times, get very upset about something, some conflict, something going on, get very agitated. And I went into his office one day in this kind of a state, expecting him to join with me in my agitation over this episode, and I don't really remember what it was. And after I explained it all to him, he said, "Gerald," he said, "you have to realize that there's certain things you encounter in life that are very much like one of these ant colonies that people have as a hobby that's in glass." Said they're really interesting and entertaining, but you have to be careful and don't crawl in there with them. And I think that approach to conflict management has stood me in good stead. But I have to say that really he imbued me with a tremendous love of internal medicine, a compulsion to try to practice the best medicine possible, a tremendous amount of respect for the patients that we are honored to be able to take care of, that trust their health to our care. The importance of mentors. He was a great mentor. He taught me to be a mentor and also to continue throughout my entire career to seek out mentors and very importantly to realize that medical knowledge is really a journey and not a destination. And I have a great deal of respect for him. Many times over the years I've thought about things that he has said, points that he's made, the emphasis he placed on patient care. I really value the time that I was able to spend with him.
In 1968, I was 1 year out of my fellowship when Bill came. The school was in the midst of a major curriculum revision at that time, and Bill asked me if I would serve on this committee. I was 1 year out of my fellowship, and I went to this committee, and they assigned me to a subcommittee to look into ways that we could introduce students earlier to patient care, patient experiences. So I got appointed to that committee, and before long, I was appointed to run a new course that was going to be in the curriculum. It was going to be 10 weeks long, which at that time, internal medicine was only 10 weeks long. I had no idea what this course was going to be about. It was going to be called Introduction to Clinical Medicine. They told me it needed to be physical diagnosis and pathophysiology of signs and symptoms. So I went to the University of Alabama, the University of Washington, because they had similar courses. And in 1970, 3 years out of my fellowship, I was responsible for 10 weeks of a curriculum in the medical school, all because of Bill Deiss. Another event occurred in, I guess it was 1972. Because of the major change in the curriculum, the dean asked me if I would help him manage this new curriculum. And I said no. And he said, well, you can do it part-time, and we'll give you a title of Associate Dean for Clinical Affairs. So I said, okay, I'll do it, and I'll try to do this for a year. After a year, he wanted to appoint me as a full-time Associate Dean, so I went back to Bill, and I said, Bill, I didn't call him Bill in those days, I assure you. I said, Dr. Deiss, what do you think? And he said, you're crazy if you take that job. You enjoy taking care of people with infections, like pneumonia. You give them penicillin and you watch them get better. With meningococcal meningitis, they get better. Nothing ever gets better over in that administration building. So I decided that I would go back to doing research and teaching. And so they appointed another person named George Bryan as the associate dean at that time. Well, the dean subsequently left, and George Bryan became dean, and I'll come back to that story in a minute. In 1984, I was in New York, and at 83, I'd planned to do a sabbatical at Stanford. And I was in New York, and I got a phone call, and it was George Bryan, and he said, Jim, we're going to ask Bill Deiss to step down. And I said, you got to be kidding. And he said, no, I'm not kidding. I said, would you rethink that? And he said, no, we've made that decision, and we want you to be the acting chair. And I said, if I accept, you're still going to, if I don't accept, you're still going to do it. And he said, yes. So I said, how long do I have to make that decision? He said, 24 hours. So that was, I got back to Galveston the following Monday, and I went over, and they announced that Bill was stepping down. You can't imagine what my gut was like when I went in on that Monday when I was the new acting chair, and everybody in the department was angry about the decision that the dean and the president had made. So I took over the job, and we did the best we could for a while. One day I went into the office, and I had a message that the President Levin had called, and he wanted me to call him back. So I went to the telephone, and there on the telephone was a speed dial. So I punched the buttons for Bill Levin, and the telephone rang, and finally on the other end it said, dog pound. Many years later, I asked Bill if he had done that, and he denied it. But I know that either before he left the office, or maybe even before he knew that he was going to be asked to step down, he programmed that to ring the dog pound. Now to go back, had I not taken Bill Deiss's advice when I was an acting associate dean and became associate dean, I probably would have become the dean, And Bill Deiss would never stepped down his chair.
I have two favorite stories, a little different, I think, from what other people have been talking about, but I think you'll appreciate them. Years ago, when I was pregnant with our son, I was here on the faculty, and I wanted to take a year off just to have the baby and bond with him, before I did anything else. It was important to me, so I went to Dr. Deiss and talked to him about taking a year off, and he said, "Yeah, you can take a year off, but I don't know if I'm going to rehire you." So that's him. And so I said, okay. So I appreciated it, took a year off, and I went back, and at that time there was a need in the clinic, actually, for faculty, and I could work half-time, which was something that I really wanted to do because my baby was still little, and I wanted to go back and work, half-time for a while, at least until he got into school. So I went back, and he not only said okay, he agreed to letting me work half-time, which at that time, my baby now is 47 years old, so at that time, it was unusual, I think, to give special requests to women, or to do something, let them do something different. The idea was that I was here and I was to do my job, and nobody would say anything to me if I did my job. So I really appreciated the fact that he was that forward-looking at that time. He let me come back, and not only that, after a few years, he let me go to 75%, and then I went full-time. But just between you and me, when you're working 50%, you're really working 75%. But I did eventually go back full-time. One other story that I really appreciate about him is that his wife's aunt was in a terrible accident and was, just really not responsive. And she was in the hospital, and she had tubes everywhere. And her two sisters said, "She's not going to die here. We're going to take her home. Take out all the tubes and just take her home, and she'll die at home." Well, they took her home, but she had such tender, loving care from all of her sisters and her family that she continued to live there, and they would feed her by mouth, and she had a grunt, and that meant she wanted ice cream. So anyway, I was just very flattered that Dr. Deiss asked me to take care of her. I thought of all the people, and as much as he knows about patients and as much as he knows about patient care, he asked me if I would take care of her, which I did. I took care of her in the home until she died. I still remember him for those two things, that he's been very special to me over the years.
Well, I had the privilege of being his chief resident. I followed Gerald Bethard into the chief resident's office, and Gerald left me with this pile of papers and things to do. And Dr. Deiss, when I went in to get my instructions for what I was supposed to do, the emphasis was on several important matters. One was the business of grand rounds, and he wanted us to work hard to develop a curriculum for grand rounds. I don't think I was very successful at doing it, but I tried hard, and with his help, we went through the faculty and tried to come up with a series of grand rounds that would be what he thought would be important for all of us to know. And that was important every week as I approached grand rounds. I was always concerned that his that we would be able to meet his expectations. He had really very high expectations for all of us. And it is true, he was very interested in every patient that was admitted to the services and would ask me frequently to check up on patients. He was always concerned about some of the patients that we had who had unusual problems, that maybe we were missing something important. And so he would send me out to go and check on the patients. And often I was out there in the evenings going around reading the charts, trying to come up with a understanding of what it was that was happening. So next morning, after morning report, I would have to give my report on the things that he had was interested in. He was very interested in all of the people, including all of the people there in the office. He was concerned about the individuals who supported us all, the secretaries and the people who did things around the department, and would ask me to do things to help them and to bring problems to him, and he would make an effort to personally go and take care of things or help individuals that needed help. Many of you may remember the secretary, Joanne, who was there in the office forever. And as she grew older and became ill, he took care of her. And in fact, even after he had retired, he looked in on her up until her death. So he was a person who had a very humanitarian streak that was very wide and was something that I was very impressed with. He was big on ethics and the ethics of how we behaved. He was concerned about, sometimes as all of us when we were residents, sometimes we may have laughed when we should not have laughed or whatever because of the stress we might have been under. And he was always concerned about that and would talk about the ethical side of medicine to me. The other part of him that I had not realized when I first started working for him, he was a reviewer for Science, the AAAS journal, and had a lot of fascinating papers that he would review for Science. And he'd sit there and talk to me about some of these papers that he was reviewing for Science. So I learned a lot in the year that I spent working with him. I felt privileged to have had that opportunity to work with him for that period of time. And over the subsequent years, I always reminded of his advice at various points in time. And the funny piece of advice he gave me, I got married during this period of time, and before I went off to get married, he called me in the office and he said, "Now, Jim, I want to tell you something." And I thought, we're going to have some big revelation or something. He said, "And I know you're going to go up there to Colorado to get married." And he said, "I want you to do something for me." And I said, "Oh, yes, sir. What is it?" He said, "I want you to be sure and speak up." He said, "I go to weddings all the time and you hear people mumble when they say their vows." And he says, "I want you to speak up loudly so that everyone can hear." And I said, "Yes, sir." So when we got to that, I remembered and I spoke up loudly, and I kind of chuckled to myself and teased my wife about that from time to time. But I have absolutely wonderful memories about him. And he, as an individual, he worked very hard for the university, very hard for the department. He personally there were lots of opportunities for him to have difficulties with all of the interaction here at the university, but he was a man of great integrity, and I respect him for that.
Well, first let me say I really appreciate the opportunity to tell you my view of Bill Deiss. I came here as chairman in 1991, and the first thing that really was really very clear, I think I figured that out when I was interviewing for the job, that I wasn't joining an institution as much as I was joining a family that had pretty close-knit views about how people interacted with each other, and the good people from the bad people. And so the real issue for me initially was, how am I going to join that family and have them to appreciate me as their new chairman, or at least listen to me, whether they appreciated me or not. And the first thing that occurred to me was I needed an internal partner. So I made Jerry Daniels my associate chair. I think a very wise decision, because he was really respected and loved by everybody, and he could give me the inside story about most of the people or the things that I ran into. The next thing I thought that might be worthwhile was to bring back some really beloved people. Ray Rimmers, for example, had left, maybe because of some interaction with Bill or others, but for whatever the reason, he had gone to Tyler and was anxious or was interested in coming back. So we brought him back, and I've never seen a person more beloved almost than Ray. Everybody thought so highly of him, and so I really got a lot of points as the new chairman for doing that. The last thing was, there was this close-knit family, but there was really an extended family that at that point wasn't having the kind of relationship with the school and the department that perhaps would be best. And so Mark Shabbat said, why don't we have an internal medicine alumni association and have people come back, and we can do it with a CME. And one of the first meetings we do will honor Bill Deiss. Well, already I had figured out Bill Deiss was really somebody, because he was really working part-time, and he was loved by the residents and the students. But talking to the other faculty, it was really clear that this was a man that was really revered by everybody. But I don't think I really realized how much that was so until that first meeting, when all of the alumni came back and they put on an afternoon of skits about Bill Deiss. And it was really, first off, it was entertaining, because some of them would play Bill Deiss and the other, and you really began to get a flavor for what this man was all about and for the excellence that he stood for. He could be tough, and people here have said, all right, he could be pretty mean. But everyone respected him, and they loved him because he held them to the highest standards. And that's what everyone tried to do. They feared him because they were afraid that they wouldn't live up to his standards of what they should be. And that meant a lot. And I began to really see what this person was all about. And I began to understand, I think, more about the extended family of UTMB and of internal medicine. And it was really an eye-opening and gratifying finding for me. Now, lastly, in terms of our personal interactions, we met and we would talk a little bit about the problems of being a chairman. But one time I was having real problems with a faculty member. I don't remember who it was or what the problem was, but I couldn't get them to do something they needed to do. And so I thought, well, Bill knows this person. Maybe I can call him in here and get his advice about what to do with this person that's not acting the way he should. So I did that, brought him in, and Bill sat down, and he listened to me and nodded his head, and I unloaded all of my story and all my problems. And then he looked at me and said, I've been there and had to do that, and now it's your turn. So you're going to have to figure out what to do. And so let me just tell you, just do what you think is right. And if it blows up, you can always change it a little bit. But he wouldn't make any judgments about this fellow faculty member. He said, you've got to figure that out. And I thought that was really good advice. You have to do what you think's right, and you proceed on and you do that. So that was my lesson from Bill. But the real lesson was that a person that has high standards, that cares about people, that interacts with students and residents and others, can lift them up to a higher level of performance. And that's what Bill Deiss did. So thank you.
Hi, I'm Scott Ream from Austin. I don't know if everyone knows me here, but I had it's a real privilege that Mark asked me to speak. We were in the same residency training group through these years, and then I was the chief resident from '76 to '77, and I really had sort of a unique year with Dr. Deiss at the time. He was going through some personal problems and things, and so often, and it's sort of a different relationship than I think a lot of other people have had. I would spend a half an hour afterwards, after morning report, just talking with him. And we didn't talk about each other's personal problems or anything else like that, but it would be talking about the world, about ethics, about how not to get caught in an ant farm, like Gerald was saying a little bit earlier. And it was really a remarkable year for me, and really grew to love him through that time. But the times that I really would have chills and sweats, and even when it did not involve me, but all through my internship, residency, chief residency, was when in morning report someone would present a patient and Dr. Deiss would look at him and say, "This patient needs a doctor." And he would get everyone up. We would walk out to the bedside. He would interview the patient. He would examine the patient. He would show, and then it was very unbelievably instructive how he showed what they'd missed on physical exam, or why didn't they take this part of the history? Why didn't they spend some more time? Or why didn't they look at the blood smear? Whatever it was. And it was just really, really a very meaningful event, although it was very scary for a lot of us. And I can say that I think through whatever I accomplished in my practice in Austin the last 40 years, or whatever I was as a physician, I really feel that Dr. Deiss had a huge part in that, because there was no doubt that going through that training program, that our responsibility was to that patient. Our utmost attention, our utmost care, our utmost concern was all related to that patient. And Ace Alsop, who is my partner during all those years, and I often would sit and talk about how much of an influence he had on all of us in that regard alone. So it was a real privilege being here under his leadership.
Thank you, Scott. I'm Al Reinhardt, and Scott Ream was my mother's physician, and he was the doctor that Dr. Deiss wanted you to be, and I appreciate that. I've learned a great deal today, that stuff I really didn't know, and it certainly does add a different perspective to a lifetime of medicine. I've written a lot of this out simply because I don't want to sound like Donald Trump. And those of you that know me know I have a propensity to do that. So that this is really an impressive audience as well. That Dr. Deiss would be very, very proud of everybody here. And if you're watching Dr. Deiss, hi. That several physicians have had a great influence and relevance in my life. You know, among them were Truman Blocker and Raymond Gregory and Jay Sanford, and a number of folks in this room at the present time that really outstanding individuals that have had a profound effect. That I doubt that any of them have had a greater effect on my career and my actual value system than Dr. Deiss. You notice I call him Dr. Deiss. He used to stop me in the hall and say, "Damn it, call me Bill." To which I can only say, "Yes, sir." And it's very true, even to this moment, that I met Dr. Deiss when I was a staff physician at the Wilford Hall Hospital in San Antonio. I had done my residency here, my fellowship at Southwestern, and I had gone to the Air Force. And the furthest thing in my mind was that I'd ever come back to Galveston. I thought about being an academician, but Dr. Deiss was a consultant to the Wilford Hall, and one day he dropped by my office, knocked on the door, and said, "Can I talk to you?" And I said, "Yeah." And he said, "How would you like to be considered to come back and do infectious diseases in Galveston?" Well, my fondest fantasy was brought about at that moment. I would be going home and going back to where I knew the people and I knew the institution. I will tell you that the University of Michigan and Southwestern really didn't hold a candle to what we had here. So I ended up joining the faculty here in September of '71 and remained on the faculty till September of '93. During that tenure was the realization and fulfillment of a dream that all I ever really wanted to be, for truth, was to be a medical student. And in 1951 or 1955, I was a first-year medical student. And in '73, I was a 20-some-odd-year medical student. And at the present time, I'm a 61-year medical student. It hasn't changed. Those values are basically the same. That he let me live a dream. Although I didn't know it at the time, Dr. Deiss was a perfect chairman. You just don't get any better than that. At the perfect place, at the perfect time. What could be better than teaching medical students, residents, fellows, and growing with the other faculty? Every day was stimulating. Every day you learned something. And I vividly remember our very first case of HIV, which was not known at the time, but it was AIDS. I remember the complex Munchausen patients I had. First time I accumulated about 20 of them, including one I made a giant mistake on because it was one of the patients with toxic shock, and that she was a nurse and that she kept regularly going into shock. And she was doing research with Pseudomonas toxin on burn patients. And I was absolutely convinced that she was injecting herself with the toxin. So one of my Munchausen's patients turned out to be one I was totally in error. That diagnosis was ultimately made by an endocrinologist who said, "I know that she goes into shock every time she has a menstrual period. And so I don't care why, but I'm going to put her on antibiotics every time she starts her period. And he did, and she never had toxic shock again until we finally figured it out. But the patients that we've seen here, the multi-phases of tuberculosis, the evolution of all of these things have really been a total revelation to me. That I remember particularly that our first case of Legionnaires, that we sort of stumbled into the diagnosis, and Dr. Schweinley and I got so excited about this that we actually took a plane to Longview to see whether we could define the epidemiology of where this bug was coming from. And we did. And it was the beginning of a real enterprise. In addition to that, several things that not only did he run a first-rate department, but he was instrumental in how the university itself ran. That I was appointed to member of the admissions committee and stayed on that for the better part of 15 years. I ran the residency advisory committee and interacted basically with almost all the students who matched in residency, but especially in some of the students who didn't match. And there's nothing more lost than a student who is not matched on that day. And they really require all kinds of special care and attention to convince them that after their 4 years that they're still wanted somewhere and that they still have a career in front of them. Last thing that he did, well, actually two things. He was instrumental in initiating the problem-oriented medical record system. He sent George Schlagenhoff and I off to learn how to do that and try to bring it here. And we sort of did that. The other and really last thing was one afternoon I got a call from Dr. Levin to come over to his office to meet with the district attorney and from representatives of various law enforcement agencies. And he had gotten clearance from Dr. Deiss to ask me if I would be willing to be their medical consultant because of some allegations that had been brought by bad practices in nursing homes. And it was the first part of the Autumn Hills circumstance in which I participated actively in that for the better part of 4 years. First time a nursing home had ever been accused of killing people. There were some 26 people that died and were brought to trial for potential murder. It didn't happen in this particular area, but it was taken over by the state attorney general that did that. That subsequently led to rather significant revisions in the way nursing homes are managed. Dr. Deiss was the consummate scholar. He was a clinician role model in the finest order, a great teacher, a great colleague, an accomplished investigator, a visionary, and a friend. He always did the right thing. I cannot think of a circumstance where he actually did anything wrong. He always did the wrong thing, and at least as he saw it. The last person on this earth that would ever sell out or compromise his core values would be Bill Deiss. That it was a great privilege to work with him. And the last thing I want to mention is that his residents, the students, and the faculty, us, are his legacy. And that we have an obligation to carry forth the principles that he taught us all. I've tried to do that, and I'm sure everybody here has done this as well. We could not have had a better role model to live our lives. It was a real privilege to know him. I wish he could have been here today.
So I'm Jim Rohack, and I had the privilege in 83, 84 to be his final chief resident and Dr. Gukian's first chief resident. So I was in a transition time period. Two observations I would give. As people have said, You know, Dr. Deiss was bigger than all of us. He was kind of this person that effused knowledge. And so Hurricane Alicia came in August of 1983. And so Dr. Deiss, and for those of us that were key individuals, we had to live within the hospital. And all of us agreed for rotations. And Dr. Deiss said, you know, treat me just like anybody else. So we schemed to wonder if this old man could still do a arterial stick. And so, yes, indeed, somebody in the ICU needed to have a blood gas drawn. And so, well, Dr. Deiss, you're up. And so off he went to do it. And, of course, we were all crowded around just waiting to see whether or not he could do it. Wouldn't you know, the son of a bitch got it on the first try. God. At that point, we knew nothing could go wrong. And then I'll give the final observation, as Dr. Gukian has mentioned, the transition that occurred. So here I am in Gerlins, in the checkout line, and all of a sudden I hear one of the checkout clerks screaming to the cashier, "Hey, did you hear the chairman of the Department of Medicine just got fired?" Of course, I had just talked to him like an hour ago, didn't say a thing, so immediately I had to go home, because this was before cell phones, to get a phone and called him at home. And what our conversation was very important, valuable lessons. Number one is, when you're going into academics, there is no job security. Number two is, politics is real and affects everyone. And number three is, if you believe in what your core mission of caring for patients, then regardless of what happens on the outside, you can feel comfortable at night that you're doing the right thing. And so I think it really was helpful for me to have that conversation, because in things that I've done from now on, as Dr. Reinhardt's mentioned, I've tried to practice what Dr. Deiss emulated, not only in his actions, but also in his words. So it's really a great opportunity to visit with you and express some of those observations I had. And unfortunately, I have to leave, because my wife has an eye appointment and I have to drive her after she gets dilated. So I will catch up with you all tonight at dinner.
I'm Rick Waldo, and I had the honor of being chief resident in 1978. To put that in some perspective, this was the year before we moved into the new John Seeley, which was 38 years ago. We were moving from a ward system where we had 4A, 4B in the old John Seeley, probably 80 people on each ward. Put that in a little more perspective. In 1978, Dr. Shabbat was a first-year fellow in GI. That's how long ago that was. My first duty that Dr. Deiss requested is take our system from the old John Seeley and apply it to the new John Seeley. And this amounted to about 115 people, doctors, of course, not just internal medicine interns and residents, but family practice, OB-GYN, internship that had to rotate through our system. And this involved all the different ward services and the emergency room and the ICUs and everything. So after about 2.5 months, and I thought I had a really good gig, you know, be chief resident. I had an office of my own and a secretary and everything. And no, it was 2.5 months of trying to fit this into that. I finally thought I'd gotten it together and went into Dr. Deiss's office, and he was reading something, I'm sure. And I had spreadsheets, I had architectural drawings. I had all sorts of ways of conveying this transference of humanity. And after about a 30-minute presentation, he said, "I don't like it. Who's going to be taking care of the patients? These doctors need more patient time." And then I was dismissed, and eventually we got it right. But this is sort of to echo what so many people have said about Dr. Deiss today, is that his main emphasis was on patient care, the ethics of patient care, and this is something that he instilled in all of us and made us better doctors and better people. So I think we owe him a great debt.
I don't know if my bronchitis is going to let me get through this. I hope it does. When I thought about this afternoon, I of course thought about what I was going to say, just as many of you did. And the first thing that crossed my mind, which had never crossed my mind really, was what I would have been like as a physician if there was no Bill Deiss, if our lives had not crossed. And I realized that no individual had a greater impact on me, other than my parents, than did Bill Deiss. Now, there are people here, many of you, Jim Gukian, Don Powell, to name two, and others, who have been great role models and teachers for me, but Bill Deiss, by far, had the greatest impact on my life. What he gave us was his time. We didn't realize it as interns and residents, and later perhaps as fellows or co-faculty, but we were his life work. We were so busy really trying to keep our head above water, dealing with the fear that you might become the object of his scorn, that we didn't think about ourselves as his life work. But we were. You know, not all chairmen are there every morning, day in and day out, at morning report, paying attention to everything that is said. I remember a morning when an intern was presenting a patient with a GI bleed, and he went on, and finally Dr. Deiss said, "Is the patient bleeding or not?" And the intern nodded, and the resident shook his head at the same time. And he then said, what you never wanted to hear, as Scott said, "Morning report is over. This patient needs a doctor." And I was surprised at Jim Rohack's story about the arterial blood gas, because Bill Deiss did not believe in intervention. We didn't really appreciate that. And often, as a resident, you would tell your intern, "Don't mention we got blood gases," okay? I mean, absolutely. I'm not kidding. And you even at times rehearsed what the intern was going to say, because ultimately you were the one responsible, because he would look at you. But he cared so much about us, we didn't really appreciate it until we moved on and realized the gifts we had been given. The fact that taking a history and doing a physical, and what you learned from that and from the patient at the bedside, was almost everything you needed to know. Now, this was before even CAT scans and many other interventional studies that are now commonly available. But he didn't have time for those. I later learned when I became his designated physician. Now, being his designated physician, I have to tell you, was much like being the director of a blood bank at a Jehovah's Witness hospital. Because he had no use for physicians. I mean, he had a bout, I later learned, of zoster involving his eye. And for that illness, he took one Tylenol. It surprised me that he actually agreed to do the blood gas and not, he certainly found out in that patient that it was in fact indicated. Because, you know, we were all young bucks and our threshold for doing poking needles various places was a lot lower than his. We just wouldn't often tell him about it. And so we survived. But the fact is, I think his greatest gift to us was being there. And not all chairmen were there. They were off at professional meetings and making names for themselves, but not Bill Deiss. I wish I had done what Al Reinertz did. I took notes over here as others were speaking. He did teach us that the patient was the first and only thing that was our priority. He taught us to do the right thing. And so many times have I heard from so many others that no matter what age they are, Bill Deiss still has an impact on their practice and how they treat patients. I've tried to tell Liz, his wife, and Paula how over those 16 years as chairman, how many hundreds of physicians he affected to make better doctors, and how many thousands and thousands of patients he affected their health care through these physicians. It's hard for them to understand that. I also want to tell you that one of the greatest honors that I think I've ever received was being told by Liz that he and Bill consider me like a son. And that's one of the special rewards or advantages for having spent your career, professional career here. And we became friends, Bill and I did. And I don't have any problem with Bill. I mean, we play golf together, and he taught me, even on the golf course, you got to watch your good shots. You know, you hit plenty of bad ones, but watch the good ones, Shabbat. Anyway, he was a kind man. We didn't know it then, but we were his love, and he has become ours as we've gotten older. I want to read this. I received several notes from some of our alumni. This is from Ned Snyder. Mark, I will not be able to make the luncheon tomorrow, but I have some remarks that I would like you to share with the group. I owe many things to Dr. Deiss, but in no order they include. As I know many others do, I attribute much of my discipline as a physician to him. At age 71, I still feel he is looking over my shoulder. Whenever there is a difficult decision, such as whether to go to the hospital in the middle of the night, the rule is still, how would it sound in morning report? In this day of EMRs, with all the blown-in material that is copied or a template that shows you things you examined that you never did, I refuse to conform because I know it would not meet the muster of Dr. Deiss if he saw the chart. It means I have the shortest notes, but I feel I am true to my training. On a personal note, I was fortunate to have Dr. Deiss as an attending on my junior internal medicine rotation. I did too, as a matter of fact. His joy of going from bedside to the textbook and back to the bedside, I've got to find it, was infectious, and I knew I wanted to be an internist. I would later be exposed as a junior medical student to him on an endocrinology elective, and he would support me on a research elective. How lucky could you get as a junior medical student? In a more global sense, I am grateful that he trained a whole generation of us in his style and challenged us to be the best both at the bedside as well as in our science. It has made for some great colleagues throughout the years, and undoubtedly our communities and institutions are better because of how he raised us. Ned Snyder. Paula, I invite you to say a few words, if you like. We'd love to hear from you. That's fine. This is friends and family, believe me.
I was just going to say it's been really fun to hear all your stories. My experience obviously was different than that because he would come home from work, that was a side, and then it was Daddy. And he was, warm and cozy, and I can't tell you how many nights when I was in high school, junior high school, I've always had horses. And my horse had a tendency to have colic. And there were many nights when we would go out to the barn, put the headlights on the arena, and Daddy would help me walk the horse around the arena. So I have kind of a whole different vision of all that. The other thing I hear about all his bedside stories, a couple of years ago after Hurricane Ike, Liz had fallen and broke her jaw, and her oral surgeon was in Houston. I think it was at Methodist. So I would drive them up there and sit with Daddy while the doctor would tend to Liz, and inevitably we would sit there and they would check her heart over her shirt. And Daddy would just look at me and roll his eyes and hit me with his knee. This is not how you do this. And I would kind of hold it, grab his hand and say, okay, let him do what he's going to do. So that went on 3 or 4 trips going to Houston. And then it got to be a joke. Let's see what else I was going to say. He did fall a couple of weeks ago, about a month ago, I guess. And he was at the ER, and they took him in for a CAT scan and everything. And they came in to take check his heart. And I swear, they put it on over his flannel shirt, and he looked at me and just kind of rolled his eyes. So it's still there. And the other thing I was going to point out is that as he sits on the couch, he has his medical journals next to him that he carries with him all the time. He goes to take his nap and he carries them. He still tears the top corner off like he's read it. And I tease him because I'll read the Discover magazine and the Nature, but I can't do the American Medical Journal. It's too. I said, Daddy, this is too complicated for me. And he chuckles about that. So anyway, and he still, instead of 1 Tylenol, nowadays he takes 3 Tylenol, and that's it. So anyway, thank you all for your stories. That was really nice. I'm sorry my brother and sister couldn't be here, but that was nice. So.
Well, I'd like to thank everybody. I think we did. Yes, please, come on up. No, come on up. Come on up. We need you on camera.
I think people are of ultimate importance, and the person who touches your life in a positive way is tremendously important. And obviously, Dr. Deiss touched all our lives, and it's wonderful to reminisce and honor him. And I want to thank you for organizing this because personally, I've tremendously enjoyed it, and I'm sure all of us have as well.
Well, I don't deserve. Thank you very much. I ought to just say thank you very much, because often, when you don't deserve it, you get blamed, right? But in this particular case, I got a phone call about maybe, 2 months ago from Al Reinertz, and Al said, Mark, do you mind if I give you some advice, And I said, what else is new from you? No. I said, no. I said, sure. And he said, I know that Dr. Deiss can't make it to a lunch for him, but have you thought about videotaping it and having people, what we did today? So it was actually Al Reinert's idea. I called him back 2 hours later and said, I'm sorry it took so long, but it's all done, okay? I did that part of it, but it was Al's idea. Y'all have been terrific. I think this is something that the department we'll share with all our alumni and certainly with the Deiss family. So it will be recorded. There will be a link for all alumni, and